Let me open by welcoming everyone to this virtual space. I appreciate people taking time out of your day to join us for this talk. My name is Warren Mabey, and I'm the director of the School of Policy Studies here at Queen's. And it is my privilege to be able to welcome you into this space. I want to take a moment to acknowledge that Queen's University is situated on the traditional territories of the Haudenosaunee and the Anishinaabe peoples. And it is our privilege and our very great fortune to be able to study here, to learn here, to interact with people here. This is a wonderful place to live, and I think that it has been a wonderful place for people to come together for thousands of years. And in acknowledging those that came before, we remember that Indigenous peoples played a role on this landscape long before settlers came to this landscape. I want to also take a minute to remind people that this is Black History Month, and Black History Month in February is being celebrated here at Queen's. I've put a story into our webinar chat, so anyone who's interested can follow that story. And there's a number of events that Queen's University have organized around Black History Month. The thing that I'd like to share with regards to Black History Month is that the School of Policy Studies is housed in Sutherland Hall, and there may be people online who are not aware of Robert Sutherland or the contribution that he made to Queen's. Robert Sutherland lived in the mid-1800s, and he was the first known student of color at Queen's University. He was born in Jamaica, and he came to Queen's in 1849. He did extremely well here at Queen's. He studied mathematics. He won a whole lot of prizes. He held a leadership role in what is today the Alma Mater Society. He graduated with honors, and he went on to become a lawyer. He was based for most of his career in Walkerton, Ontario. And as a lawyer, he helped many, many families and many people become established in those areas. He was connected to the Underground Railroad and played a role there. He was, as I say, one of the more distinguished graduates that we had. And when he passed away unmarried in the 1870s, he left his fortune to Queen's. And the money that he left to Queen's, which at the time was about $12,000, but you can imagine that's a lot of money in today's terms, actually saved Queen's at a time that Queen's University was suffering from a series of bad financial incidents. They'd lost a lot of money in a bank crash. So Queen's was able to remain a standalone institution, largely because of the generosity of Robert Sutherland. For many years, he wasn't well known on our campus, and we weren't celebrating the huge contribution that he had made. About a decade ago, there was a strong effort among students and among faculty on campus to better recognize his contributions. And we did rename what was at that time the Policy Studies Building, Robert Sutherland Hall. And I'm honored to be able to be housed there and to be able to have that association with someone who gave so much to our university, and indeed, essentially created the university that we live in, or ensured that it would be present. This lecture is the Donald Gow Memorial Lecture. And this lecture series has been on the go for 50 years. It honors Donald Gow, who was the first director at Queen's of the School of Public Administration. It's designed to bring high profile and prominent Canadians engaged in public affairs to Queen's to speak to issues of Canadian public policy. For the last few years, we've been deeply involved with students to identify speakers that they would like to see in this series. Past speakers include Elizabeth Dowdeswell, the Lieutenant Governor of Ontario, Jerry Dias, who is a former president of Unifor and has gone through some difficult times later, Thomas Mulcair, who served as the leader of the opposition. We're really delighted today to be able to welcome Andrea Gunraj to speak to us. Andrea is the Vice President of Public Engagement for the Canadian Women's Foundation. She's been engaged in community-based programs and development for over 20 years and has worked with a number of different organizations and is a leader in equity, inclusion, and anti-racism practices. She has a Master's of Criminology from the University of Toronto, and criminology is one of those fields that I was always so fascinated by when I was a student and strongly considered taking myself. So I think that that's a terrific background. We're really looking forward to hearing your remarks, Andrea. And I want to point out that Andrea is stepping in at the very last minute for Paulette Senior, who was going to speak today, but unfortunately is quite ill and wasn't able to join us. So Andrea, we're thrilled that we have you with us, and we're really looking forward to your remarks. And we pass our best wishes along to Paulette. So I'm going to turn it over to Andrea. Thank you so much.
Well, thank you so much for that wonderful introduction. As it was mentioned, my name is Andrea, and I just want to thank you for allowing me to join you today. And I know that Paulette, she really wanted to be here, but she was dealing with a lot of issues today, illness related, and we all know what that's like, I think. So I hope that I will do justice to the material she wanted to bring to you today. And it's just an honor to be able to take her place and be able to interact with you. Now, I'm going to be doing a lot of talking, and I'm mindful that my favorite thing is actually conversation. So I'm hoping that you folks will feel comfortable in thinking about questions and comments in that time when we are going to get to questions and comments. So please bear with me, and thank you for your patience in presentations online, which can be really tough. I'd like to start today by acknowledging that I'm coming to you from Toronto. It's the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples. And it's now home to many First Nations, Inuit, and Métis people. But I recognize that land acknowledgements are not enough. They do not remove systemic barriers facing Indigenous peoples. And at the Canadian Women's Foundation, our pursuit of gender justice is deeply intertwined with pursuing truth, reconciliation, decolonization, and allyship in all our work. And we work to prioritize these principles in our funding process, our advocacy work, our strategic planning, and organizational development. I want to thank Queen's University School of Public Policies, or Policy Studies, that's the way to say it, for the opportunity to present this year's lecture. And as I mentioned, I am stepping in for Paulette, and she's sorry she couldn't be here, hoping that we'll still have a really good conversation about this idea of resetting normal. Systemic change and policy change is a focal point for the Canadian Women's Foundation, as gender equality and justice cannot be achieved without systemic change. I'm going to share my screen so that you can see a bit of a presentation as we go along to guide us. Here's a quote from Maya Angelou that we love at the Canadian Women's Foundation and that Paulette particularly appreciates. In her book, Letter to My Daughter, Maya Angelou writes, "You may not control all the events that happen to you, but you can decide not to be reduced by them." It's very interesting. While we were living in the pandemic, and while we are living in it, there are moments when we feel reduced. We struggle with dealing with public health guidelines, a heightened uncertainty, and looming questions about what the future will look like. Things like, when will the crisis be over? What about the impacts of what happened? Huge and gendered as they are. What about the economy? Will I keep my job? Will I get a job? Will things ever go back to normal? No one has the answers. And in fact, uncertainty and struggle has always been a part of our lives, especially those of us who have lived on the margins and have always been impacted by crises. And if we think back on challenges we've weathered in the past personally, there are ways that they can leave us wiser and better prepared for the future. They can help us shift our worldviews and unveil hidden perspectives. They can help us change our behaviors, assumptions, relationships, and plans if we're committed to learning from them. Now, I definitely don't want to diminish the devastating impact of the pandemic. And I think it'd be wise for us, though, to take the shakeup as a chance to envision a better future that could come from it. It's in pursuing that future that we can choose to not be reduced. This crisis has exposed hard truths about what we think of as normal. It's cast new light on longstanding inequities and made them impossible to ignore. We've seen how the intersections of gender and race and colonial injustice have put marginalized women at high risk of contracting the virus. It's created job losses for them and economic instability, as well as impossibly heavy caregiving burdens and rising levels of violence. And of course, those of us who are in precarious positions before the pandemic are at risk of falling through widening holes in our social safety net as the inequalities of our systems and institutions have come into clearer focus. And I'm talking caregiving, education, health, the economy. If we continue to accept this version of normal where things are worse off than they have been before for women and gender diverse people especially, we have to ask ourselves what happens when we face the next crisis, whether it's a pandemic, an economic recession, a climate event, or all of the above. Will we wait for future shocks to widen existing social gaps even further, leaving more and more people to fall into the cracks? Or are we going to act on the lessons we've learned and invest in better preparing ourselves for the future? At the Canadian Women's Foundation, we do believe it's time to act and invest and reset normal. In fact, we collaborated with other organizations to produce Resetting Normal. This is a series of reports that provide recommendations and strategies on how we're going to do that. But before I delve into it, I'll give you a bit of background about the Canadian Women's Foundation, who we are and what we do. I'll share my screen so that you can see. The Canadian Women's Foundation, we are Canada's public foundation for gender equality and justice. We've been working to advance gender justice for more than 30 years. We fund programs and services throughout the country that empower women, girls, and gender diverse people to move out of poverty, out of violence, and into confidence and leadership. In addition to supporting communities at a grassroots level, the foundation also works on a policy and fundings and systems level. We work to end gender-based violence, to end poverty, to build girls' economic empowerment and support, and build inclusive leadership. These are four big areas that we need to move the needle to achieve gender equality in Canada, gender equality and justice in Canada, prioritizing the most vulnerable individuals and communities to get the biggest positive impact. This includes women with disabilities, Indigenous women, racialized women, newcomer women, and women living on lower incomes. So now that we know more about the Canadian Women's Foundation, I want to come back to this idea of resetting normal and how we develop this policy, reports, and these recommendations that center gender justice in pandemic recovery. Soon after the crisis hit Canada, we knew we needed to understand its impact on equity-seeking organizations we fund and the communities they serve. These are organizations that provide things like shelter and housing services, sexual assault services, job skills, training, and employment services, as well as after-school and youth programming that families rely on. They're all over the country, including rural and remote communities where services and resources tend to be few and far between. We surveyed more than 120 service providers throughout Canada, and we learned some difficult things. Almost overnight, their already marginalized communities were dealing with things like job losses, food insecurity, lack of access to digital services and reliable internet access, as well as increased stress, mental health and substance use concerns, and risk of violence at home due to necessary lockdowns. The service providers themselves also had to deal with incredible challenges. While many had to reduce staff and could no longer rely on volunteers because of social restrictions, they also had to figure out how to serve their clients safely and shift their services online. Expenses skyrocketed, and they quickly upgraded their technology, implemented more rigorous cleaning and sanitation protocols, and invested in personal protective equipment. And you can see how that would have a huge financial implication on them. One of the most critical learnings from this survey was that 80% of service providers said they were concerned about their ability to continue delivering services. At the same time, they knew this was the time when their communities needed them most. So for the foundation, it was urgent for us to advocate for funding on behalf of these critical service providers to help meet these immediate and emerging needs. At the same time, we were seeing clear and shocking indicators of gendered and intersectional impacts of the pandemic. Here's just a few. Women's workforce participation dropped to its lowest level in 3 decades. It was a historic low. In Ontario, racialized women, Indigenous women, single mothers, low-income women, immigrant women, women with disabilities, and those living in rural areas experienced the highest income loss as a result of COVID-19 related shutdowns. 1 in 3 women actually considered leaving paid work to manage unpaid home responsibilities. And when the pandemic began, 1 in 10 women were very concerned about the possibility of violence in the home. We knew we couldn't just let this crisis continue to roll back decades of progress towards gender justice. So we had to make a strong case, not just for turning the trajectory around, but for building a foundation of gender justice so solid that it can't be shaken by future crises. We began collaborating with other organizations and experts to bring intersectional gender-based analysis, strategies, and policy recommendations on key areas of concern for the gender equality sector, the care economy, gender-based violence, and inclusive leadership, and more on that in a few minutes. Through this work, we produced those 5 resetting normal reports that are the basis of our recommendations for pandemic recovery. What emerged from them was 3 powerful lessons that should guide the policy and systemic change we need to weather the challenges ahead, come out stronger. The first lesson we found is that community care is an essential service. So before the pandemic, you'll remember that essential services was generally thought to mean first responders, like firefighters and police and emergency room doctors, along with some municipal services like garbage collection. It wasn't widely understood until the crisis hit that keeping people safe and healthy also depends on long-term care, home care, childcare, and the many services offered by women-led sectors like shelters and sexual assault counseling and other family services. Now, the people who rely on community care are amongst the most vulnerable in our society. That includes seniors, people living with disabilities or chronic illness, infants and children, and people who experience gender-based violence and sexual assault. Despite these high needs, community care across Canada has been underfunded for decades. These community care services are important to gender justice, since most of the people who access them are women or parents, and many of the people who deliver them are also women and gender diverse people. More broadly, we have to recognize that care is essential to the function of our society and economy as a whole. None of us as individuals will be where we are today without care. All of us at various points of our lives, yes, have depended on the care of others. But we still have a societal operation. We have this assumption that women will give up their livelihoods and provide care for free at home, or that marginalized women will continue to provide care for poor compensation. Right now, many of these women don't even make living wages. So if we're going to reset normal, we need to look at our economy as a care economy that gives essential service and that also gives the people who deliver it their due. In our Resetting Normal reports, we call on a few key starting points. First of all, we need to make care work, excellent pay, protection, and benefits, excellent working conditions. We need to make our new national childcare system We need to make it universal, accessible, making sure that it's prioritizing the most vulnerable families. We need well-paid workers here, the right infrastructure, and significant funding to match the need in our communities. We need big investment in care systems for seniors and people with disabilities, including assistance for families who struggle with costs. And we need to strengthen core funding for women and equity-seeking organizations that provide things like shelter and housing and sexual assault services so they are positioned to thrive rather than just barely scrape by. So this brings me to our second lesson from Resetting Normal, which is that inequality is harmful to our collective health. The pandemic is a harsh reminder of the individual and collective harm caused by inequalities. As in all disasters, the most vulnerable people carry the heaviest burden, and it is hardest to recover for them. But this has implications for all of us. We do need to get past this idea that personal wealth and privilege and power insulates us from the consequences of inequality. In a sense, they do, and in a sense, they don't. We actually all have a stake in dismantling the intersecting barriers that continue to oppress some communities more than others. The crisis highlighted the powerful influence of social determinants of health, the impact of things like race, gender, economic status, immigration status, and other factors on people's livelihood and likelihood of, say, contracting COVID-19, on the severity of the illness they experience, and access to protections like vaccines. When it comes to low-income and racialized community, for instance, COVID-19 infection rates have been higher, and the health outcomes are worse because of long-standing systemic discrimination. Multiple factors make it difficult to follow health protocols. Things like more crowded living situations, a dependence on public transit, and employment in jobs where working from home is not going to be an option, and when there is no paid sick days in place. Now, gender also played a role here. When it comes specifically to racialized women, there tended to be, of course, a higher rate of unemployment. So they were more likely to be primary caregivers, which means a higher risk of COVID-19 contraction. Racialized women are also disproportionately represented in health and caregiving roles, things like nursing, personal support work, and daycare provision, where they do also face a higher risk of getting sick. Despite the evidence that the pandemic was causing disproportionate harm to low-income and racialized communities, many governments across Canada initially stuck to a one-size-fits-all pandemic strategy, particularly around vaccination access. This contributed to soaring infection rates that actually prolonged lockdowns for everybody and has brought the healthcare system to the brink of collapse. It has ultimately contributed to a reality where most of us are now grappling with a weakened healthcare system, dealing with high rates of staff burnout, attrition, and retirement. The pandemic once again proved that policies cannot continue to ignore social determinants of health and well-being if we expect to overcome future crises. And that means that we need to prioritize taking meaningful action to end systemic discrimination and long-standing historic injustices. It means marginalized communities in decision-making. It means recommitting to recommendations already issued by these communities and social movements. For instance, we know not enough is being done on recommendations on the final report to the inquiry of missing and murdered Indigenous women, and many of them do address the social determinants of health. The pandemic also exposed a lack of disaggregated race and gender-based data and analysis that can help us understand how marginalized and traditionally oppressed communities are being impacted. We also need data and analysis that seeks to understand the differences between marginalized communities. For instance, Black communities are often lumped in with other racialized communities, in spite of the distinct history of Black people in Canada and the legacy of anti-Black racism. People have called for disaggregated and race-based data for years, and the pandemic has catalyzed some progress on that, but we have to upfront it as a priority so we can get better targeted strategies and solutions. So some of our other recommendations for resetting normal to achieve equality include conducting race-based plus analysis on all government policies to identify barriers, including gender and race and other intersecting factors. Increase collaboration and allyship between social justice movements and organizations to strengthen our platforms and calls to action. And on an individual level, and we can all do this, a stronger commitment to educating ourselves on our histories and legacies of harm, engaging in difficult conversations and building bridges of understanding in our work and our personal lives. So this brings me to the third lesson, which is that our leadership models are obsolete. There's a clear line between a lack of representation and social and economic inequalities. Inequality is baked into our economic, political, and public systems. This includes education, criminal law, policing, healthcare, and social services. We have to remember that these systems were imported and imposed by white, primarily English-speaking, land-owning, cisgendered men from upper classes. So not surprisingly, they created laws and policies and structures that maintain their power and restrict women, gender diverse people, Indigenous and racialized people, to name a few, in different ways. But most of us do continue to believe that inequality is the fault of the individual. It's still individualized, and the systemic causes remain invisible. Over the last few decades, leadership roles in most public and private institutions have slowly expanded, and they are including more women and previously excluded groups. But despite the reforms and good intentions and public consultations, these systems still can operate in paternalistic ways. While adding diverse voices to institutions, yes, is important, it doesn't necessarily lead to systemic change. We need a new mindset, a new vision for inclusive and transformational leadership. Our political, economic, and social systems otherwise will continue to replicate inequalities. Inclusive leadership is based not on traditional patriarchal hierarchies, but on networks and collaborations. In this model, consultation won't be good enough. Decision-making must be shared. Inclusive leaders understand that the best solutions don't come from the people at the top, but the people closest to the problems. Building intersectional gender justice is vital to address the leadership gaps that continue to replicate historic inequalities. All voices must be heard. I know it's a cliche, but it's still very true. Decision-making processes and the resulting decisions must address the full reality of women and gender diverse people's experiences. So our resetting normal recommendations on leadership include this. Things like investing in new networks and partnerships between government and women's and communities organizations to foster the leadership of diverse women and gender diverse people. Collecting data to learn how to better support women leaders in Canada. Addressing systemic barriers to diverse leadership like sexual harassment and discriminatory workplace environments, and being able to do things like implement more family-friendly policies, which will help everybody. So the three lessons I've just shared are part of the Foundation's vision for resetting normal and better preparing ourselves for future crises. Perhaps most importantly, resetting normal means understanding the links between community care, inequity, inclusive leadership, and intersectional gender justice. At the Foundation, we're trying to use our platform to advocate for these recommendations and work to implement these lessons in our work across the gender equality sector. So I'd like to share an example of how we're doing this right now in a national project that is related to gender-based violence in particular. As I've mentioned, though, this is a huge issue. Gender-based violence has spiked in the pandemic, and that spike, we're still seeing it today. It happened around the world and in Canada. 53% of shelter services saw an increased demand for support. 49% indicated that they received an increase in crisis calls. There's also been a reported increase in the severity of violence and the rate of femicide in Canada over the past few years. This didn't come as a shock to the Foundation or the gender-based violence sector. This increase in violence is part of a predictable pattern. When communities are under stress from things like disasters and floods, and wildfires and economic downturns or public health crises like pandemics, gender-based violence tend to spike. But we live in a society that tends to accept gender-based violence as a fact of life. Rates of gender-based violence are alarmingly high in Canada, and this was the case before the pandemic. On average, a woman is killed by her intimate partner every 6 days in this country. We continue to live in a culture where gender-based violence is mired in stigma and silence, and often misunderstood as a personal issue rather than a societal one. Well, we don't accept this as a status quo at the Foundation and other gender justice services and supports. We believe that this pattern of increasing violence is preventable if the right conditions are put into place now. And that's what the Shockproofing Communities Project is about. It aims to address longstanding gaps in essential gender-based violence services and equip the sector to respond to these barriers. So to that end, the Foundation has partnered with Women's Shelters Canada to host a national summit in Ottawa in March. 500 organizations will be invited to come and strategize to shockproof communities. It's a national project, and we prioritize bringing people together who are often left out of national conversations. These include Black and Indigenous folks, 2S LGBTQ plus people, and women and diverse people with disabilities from rural areas and from the northern part of Canada. What we learn at the event will help us advocate for policy and funding and systemic change that we need to better protect women and gender diverse people from future spikes in violence. We hope this project will establish a model for future efforts to strengthen essential services in Canada so they're more resilient in the face of future shocks, and there will be future shocks. I'd like to wrap up today by saying that as we look forward to pandemic recovery, the Foundation's work is propelled not just by the lessons we've shared today, but also by the words of Rosemary Brown, one of our founding mothers and the first Black woman elected to a provincial legislature in Canada. She said, "Until all of us have made it, none of us have made it." She was talking about looking beyond our own personal successes, being inclusive, using our privileges and our platforms to remove barriers for the most vulnerable and marginalized people. If we can all embrace that spirit, we'll move closer to creating the kinds of systems in society that doesn't allow people to fall through the cracks. And for those of you who are pursuing policy in your careers and in your work, I hope that gender and social justice principles will be there to guide your way. If the whole purpose of social policy is to reduce inequalities between groups and make our lives better, then we really have to look more closely at why our current policies seem to serve some, but exclude others. Now, it's encouraging to see that we're seeing a lot of fresh momentum around social change and more urgency around things like the National Child Care Plan and issues like livable wages and paid sick days. And although the pandemic has worsened inequality, this experience has also shown us how interdependent and connected and human we all are. So it'd be wise to hold on to this tightly, that sense of humanity, and channel it into our policy work. So ultimately, we create a Canada where all of us can make it. Thank you again for having me here today. And if you'd like to learn more about the Canadian Women's Foundation, please feel free to check out our website, in which you can see on this slide, canadianwomen.org. And I'm happy to answer questions. I look forward to the discussion ahead. Thank you so much for your patience.
Thank you so much for that presentation. It's powerful and it's rich, and there are so many important messages that you've brought across in such a short time. I want to remind folk online that we have a Q&A function, a way that you can post questions to our speaker, and Andrea is here to answer some questions. I do have some questions of my own, and maybe I'll take the moderator's privilege to start posing some of them. One of the things you said really resonated with me when you talked about how during the pandemic, particularly during the early days, governments sort of came up with these one-size-fits-all policy solutions. You know, there wasn't a lot of nuance. and it really just sort of steamrolled out, and they were in a hurry, and I think a lot of things maybe didn't go as well as they had hoped. One of the things that I always think about is, are we training our students, those that are going to go out into the public service, are we giving them the right tools that they need to be able to build the right policies? Are the governments equipped to build those policies, particularly in an emergency situation, in a pandemic situation? Do you have any thoughts on that? I think you started to touch on it when you talked about leadership, but I have questions about that too. So over to you.
Well, thank you for that great question. I think you've touched on a bit of a nerve in the world. I think you're right. There has been this kind of rush to be able to get things done. And of course, speed in a crisis is absolutely key. You do have to be able to roll through quickly. And I would say yes and no in terms of the responses. So we saw, for instance, in the city of Toronto, where I live, we saw that the vaccines were rolled out real quickly. And what ended up happening is that areas that are higher income got them fast right away, and they were able to get into the appointments. And lower income communities, it took a lot longer. There was a lot of problems getting people out. And I think that that was one of the things that we could have planned for, but you can't plan for things when you're in the thing. You have to do it before the crisis even hits. And that's where the shock-proofing idea comes.
Yeah.
I think that's the idea that we're trying to say, if you plan ahead, if you take the lessons learned from other jurisdictions, even because we may not have it here, we may not understand. That's where you plan ahead of time and you think upfront about equity issues, kind of understandable equity issues. When you're living in a rich area, it's easy for you to travel somewhere to get a vaccine. When you're in a poorer community and you have working hours all day of the night, it's going to be hard for you. So you're going to have to think about 24/7 services, for instance, to be able to vaccinate people in a schedule that works for them. You're going to need incentives. And I got to give a shout out to some of the public health workers in Toronto with that, because we saw Black Creek Community Center was a great center that had all these incredible incentives, and they came up with it on their own. They did things like creating programs so that when you got a vaccine, you got a meal. And the meal was Caribbean food. My family's from the Caribbean. I was loving that idea. That's the kind of, I think, visionary approach to public policy implementation that we need as a matter of course. And this is a small example, but it's a beautiful example because vaccine rates really did increase in the area. They were able to measure that when they did the right things in place. They thought about people as human beings.
Thank you so much for that. I really like the idea of the food. I think that that's brilliant. And it really speaks to how important it is to get some of that bottom-up input, right? Because what works in one community is probably not going to work in another. And it's really important that we build structures that respect that. We do have a question or a series of comments from Kathy. And Kathy, I'm just going to read out your note here so that everybody can hear. Thank you for all your hard work. I'm sorry I couldn't get in on time and missed the intro. I'm the mother of a disabled 15-year-old daughter who was constantly discriminated against in childcare centers. Even before COVID, this is an individual who had to go in and out of the workforce. The national childcare policies come in, but this person, Kathy, is still left out. We're now at the point where we have a 15-year-old daughter. She still can't be on her own. She's been advocating for change in the extension of community classes and core resource rooms to include before and after school care. I feel that I've been ignored and dismissed. I keep trying. I'm also an HR professional, so I use my knowledge to try and help advocate. I just wanted to share this because I know families like mine often get left out of the conversation and we still haven't been included. And, Kathy, that's a really important thing to share. I think that people need to know about these experiences in order to be able to respond. And for our students online, these are the people that we're hoping to serve better and to support better. Andrea, I don't know if you have any comments there.
Just Kathy, thank you for sharing your experience. I think you point out a really good reality that we need to remember. It's not just childcare for younger kids. It's also care for anybody who needs care, not leaving families, particularly women, because it does fall to women most often. Remembering that care means so many things. You also remind me as well to say that sometimes care looks like care of elders. Sometimes care looks like care of adults with disabilities who need support. Sometimes care looks like community care. It's not even people in your own home, but it's people you love in your community that you're there for. So I just really appreciate that. Thank you for sharing your experience, and I just more power to you as you advocate for yourself.
Yeah, thanks for that. Helen is asking, would you comment on ageism in our society? Does the experience of the pandemic suggest older adults, especially in long-term care, were expendable? I appreciate too the implications for an exploited workforce in long-term care who are often racialized.
Helen, thank you so much for bringing that up. Oh my goodness. Yes, we did see. So we saw death rates higher for particularly elderly women, older women who are living in long-term care facilities. That is a clue right there. There's a gap. That should never be the case, that you're living in a facility that is healthcare oriented and you're dying at higher rates. So definitely some policy approaches that we have to address there. And we did see a report, particularly in Ontario, but I think it would probably go across many provinces and territories that long-term care is broken. I can say that quite strongly. And again, who tends to access long-term care and elderly care? It's women. Women live longer. So I feel there's a combination of ageism that happens and sexism that plays out as well too. And of course, the exploitation of workers in these care facilities. It's so important because it's one of those things that, we look, what we invest in shows what we care about and who we care about, and who tends to be underpaid, underprotected. It is racialized workers. It is equity seeking workers. And they're also caring for people who are undervalued, older folks, younger children as well too, people with disabilities. These are all the kind of areas when we talk about care, we have to be careful not to just say it's child care. It is care. And that's why our care economy has to be so strengthened right now. People have talked about it as a patchwork of systems that easily break apart in crisis. And we've seen that in the pandemic. What we now do in the future, what we invest in, is going to have to be a priority around care. And it is on a provincial and territorial level. But of course, we know that the federal government can outline ways that we are going to implement these things on a provincial and territorial level. And we remember as well, too, that child protection is a part of that. Thank you for that. That is such a good thing.
Yeah, and so topical in a country that is seeing an increasingly older population, where standards of care or the definition of care has to be extended. We need to be thinking about it very differently than maybe previous generations did. So again, that kind of adaptive management. Again, I'll remind people we have the Q&A function. If you do have questions, we have a few more minutes. I do have a couple other questions myself, so I'm going to pose another one. You talked about data collection and the need for better data, which I couldn't agree more with. I think that the better data that we have and the more data that we have, the better decisions we can make. But one of the questions I always ask is, who should be responsible for the data collection? Is this purely a government job? Like, are we relying on StatsCan or the Ontario government? Are there ways or models that we could adopt that would see, maybe not-for-profits contracted to produce data or to house data or to present data? There's a really interesting project that is being carried out here at Queen's right now in conjunction with the city of Kingston to build a dashboard of just really useful information and data that people can use to help support decision-making. Do you have thoughts about that?
Fantastic thinking. I mean, I think we often go to that default of government. And I think government has a huge responsibility here. Hey, you're representing people. You better know who these people are and what they need. How are you going to do policies otherwise? How are you going to make sure your policies are actually effective? It's a great strain for us to do to really push for better government data collection. But I think you're right. I see data as an ecosystem. And that ecosystem has to include nonprofits, has to include universities and colleges, has to include, yes, government, has to include every service that provides something to the public. You collect it, you feed it back. I love the idea of dashboards. I love them locally, regionally, and nationally. That is very cool. And I think one of the things that, has been cautioned, or a big caution that comes to us is when you have a service or a support that is doing the data collection and framing data, you can have gaps in that data because of the way that they frame it. People have questioned, for instance, police data. Police data just gives you one piece of the puzzle, but it doesn't tell you everything about crimes being committed. It doesn't tell you everything about unsafety. It doesn't tell you things about even gender-based violence, which happens to take place oftentimes in public and private spaces, not in public spaces, and tends to happen between people who know each other. So completely underreported. If you just go with the data that the police collect, you would have no idea about this issue. And of course, I love to be on a tear about police and crime data because of criminology backgrounds. But you can say that for any system. You can say that for health. You can say that for education, whatever the case may be. So we got to get really strategic on the places that we collect data. I love the idea as well, too, of what can we use technology for. Now cell phones are more common than ever. There's still a data gap, or still a tech gap. So I would be careful about that. But there's different ways that people are accessing technology. Can we ask people questions about their experiences and their needs through new technologies? I don't see why not. And I will hold my tongue about what the Canadian Women's Foundation is doing, but we are very interested in how you do data in different ways that get to underheard voices, particularly women and trans, two-spirit, and non-binary people. Thanks for bringing that point up.
That's great. So I'm just looking at our time. We're just coming up to 1:20, and we were hoping to finish right about 1:20. I believe, Sam, you're going to bring Michaela on to offer a thank you to our speaker. Michaela, are you there?
Hi. Yes, Khadija and I are here.
Great. Thank you. I'll hand over to the two of you to say thank you.
Okay, perfect.
Andrea, on behalf of the School of Policy Studies and everyone who has joined us online today, we want to thank you again for speaking to us on the importance of valuing community care as we strengthen our pandemic recovery efforts. Your thoughtful comments regarding how we must value our care economy and prioritize investing in new networks and partnerships between government and community organizations to protect the most vulnerable members of our community was heard, and it's something we should be implementing.
And just to note, to end off of that, and as future public servants working on public policy, we must really strive to bring gender and social justice principles into our work to create more inclusive policies and programs. So just thank you again for everything that you've had to say today.
And let me add my voice to the chorus. Andrea, you stepped in at the last minute and you gave us a tremendous talk and a lot to think about. And I really appreciate it. So thank you so much. And thanks to all online. We'll sign off now, but we'll look forward to seeing you again soon.
Thank you so much, folks. I appreciate it. And you give me hope. Much appreciated. Thanks for your patience. Have a great rest of the day.
Thank you. Bye now.
Bye-bye, folks.